Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me Dr. Jonathan Kaufman, who is David Banks' Glass Professor at one of the premier multiple myeloma centers in the country, the Winship Cancer Institute at Emory University. And he's going to talk to us about breaking news from the American Society of Clinical Oncology meeting on a totally new class of drugs, trispecifics for multiple myeloma. So, welcome, Jonathan.
Thanks so much for having me.
So we're going to talk about two of the abstracts that were presented at the ASCO meeting. So we'll start out with the first one, which is a drug from Janssen, which is a trispecific antibody. And could you just, for our audience, educate them on what a trispecific is and
Yeah.
what this particular trispecific does?
Yeah, so bispecifics are now all old news. And remember the bispecific binds two things. In the case in the most common targets that the bispecifics bind is CD3 to activate the T cells and the antigen, what's identifying the plasma cell, BCMA. And we now have three approved drugs that are bispecific targeting CD3 and BCMA. And we have one approved drug, one approved bispecific targeting GPRC5D and CD3. And so what this drug does, the trispecific, it targets three things: the CD3 to activate the T cells, and two different targets on the myeloma cell, the BCMA and the GPRC5D.
So, for this specific drug, what was broadly the trial designed?
Well, this was a initially a phase one study trying to in patients with what we call triple class refractory, relapsed refractory myeloma, refractory to three of the main classes of drugs we use: the anti-CD38 monoclonal antibodies, the IMiDs, and proteasome inhibitors. The purpose of the study was to identify the safe dose, identifying dose-limiting toxicities, coming up with a preliminary efficacy assessment, and identifying what we call the RP2D, the recommended phase two dose. This is again a phase one study trying to identify the right dose and schedule, and then the phase two is how effective is this drug?
So, what was the population of patients accrued?
So again, relapsed refractory